A patient cannot abduct their arm beyond 15 degrees. Which muscle is likely damaged? The deltoid muscle. Correct. The deltoid is the primary abductor. A stab wound at the transpyloric plane. Name 3 structures found there. Pylorus of stomach, neck of pancreas, and fundus of gallbladder. Excellent. That's correct. Which part of the ureter is most constricted? Ureteropelvic junction, crossing iliac vessels, and ureterovesical junction. Excellent. Those are the 3 key points. Which structure is most posterior in the root of the lung?
The bronchus.
Correct. Which cranial nerve is most vulnerable in cavernous sinus thrombosis? Abducens nerve. Correct. A fracture of the medial epicondyle affects which nerve? The ulnar nerve. Correct. During thyroidectomy, which nerve is at risk when ligating the superior thyroid artery?
The external branch of the superior laryngeal nerve.
A stab wound at the left fifth intercostal space mid-clavicular line affects which structure? The apex of the heart. Correct. A patient cannot look down when the eye is adducted. Which nerve is affected? Trochlear nerve. Correct. Which artery is most commonly involved in epidural hematoma? Middle meningeal artery. Correct. Which vein is used for central venous access because it has a straight path to the heart? Right internal jugular vein. Excellent. Why is scaphoid fracture dangerous?
Risk of avascular necrosis due to poor blood supply.
Exactly. That's why early detection is so critical. Which muscle initiates abduction of the arm from 0 to 15 degrees?
Supraspinatus.
A patient sticks out their tongue and it deviates to the right. Which nerve is damaged? Right hypoglossal nerve. Exactly. The hypoglossal nerve controls tongue movement. Which organ has both endocrine and exocrine functions? The pancreas. Excellent. The pancreas is correct. Thank you. Now, let's discuss its dual roles. A fracture at the base of the skull causes CSF rhinorrhea. Which cranial fossa is involved? Anterior cranial fossa. Correct. And why is that? Which muscle is the only one supplied by a cranial nerve that is not a brainstem nucleus derivative?
Stylopharyngeus. It's supplied by the glossopharyngeal nerve.
Exactly. Well done.